welcome to all of you. Myself Dr. Tikendrajit Sharma, Associate Professor from Cervical Department of Government Ayurvedic College. Welcome to all of you to our Marma OPD along with my assistant professors Dr. Torali Borua to our respective unit. So we are going to the exactly the procedure by what procedure we are doing in the Government Ayurvedic College. So here one volunteer from our government college is here. So we want to see how we will do regarding our Marma. So here first we want to show regarding our Om Shanti. It is one we are following it for the relaxation. So it is normally we are done for the 1 minute. Then we try to go for a Marma. For example, as we already said, regarding Thaponi Marma, here we are putting our two finger. We are putting our two finger or single finger. Then we try to give it pressure. The formula is during the time of our exhalation, the pressure should be given. So this is one point. Though low back pain is a pain disorder that occurs in our posteriorly, as Marma shows that the involvement of our life energy or derangement of the life energy, hence correction of it from the anterior aspect is also essential. Now this is our show. We are taking some Marmas of our front anterior aspect. So this first one is there is Thaponi Marma. This is our Shankha Marma. What we want to do it here? This is one kind of the relaxation technique again. Here we want to do that is our rotatory movement. That is our rotatory movement, and we want to move along. We want to move our finger in the junction between our ear as well as our hair. Here we try to rotate it. It should be rotated 10 times in a minute. Next, what we want to do, it is said as our lotus open and close. That means our hand should be placed just above the auricle. Then we try to give the pressure. Try to give the pressure during the time of exhalation. Ask the person to exhale. So during the time of exhalation. So here he is exhaling. So during the time of exhalation, the pressure should be gone. This is defined as the Simanta Marma, and we are doing it. Formula is same thing, that is 10 times in a minute. Next we try to do one very specific point which is defined as our Krikatika Marma, where pressure is given between the head as well as our neck. The joint between our head as well as the neck, here we try to give the pressure. Here we try to give the pressure. Now the pressure is given, same formula, during the time of exhalation. All these are done for the relaxation of that particular person. This time, that is our 10 times in a minute, and it is very effective, specifically in relation with our Parkinsonism or other tremor related disorder. So now, this is our prone position. Now we try to give the different Marma or different pressure. Before that we have to know what are or where it remains. First, this is our Amsa Falaka. This I will show it later. Now this is our specific Marma that is defined as our Parsha Sandhi. How we assess? The formula is give the pressure through the thumb in our renal angle. Our renal angle. So this is our costovertebral angle or the renal angle where pressure has to be exerted by our thumb. This is the portion. The pressure has to be exerted during the time of exhalation. In this way. So this is termed as their Parsha Sandhi. Then this is followed by, there you can see two dimple is there. Two dimple is, you can see both these two different dimple. Now here we try to give the pressure. Here we try to give the pressure. You can see both this one. Same formula, try to give the pressure during the time of exhalation. This is defined as Kotika Toruna. This is defined as Kotika Toruna, like this way. The pressure should be go from the backward to the upward, like this way. The same thing, it should be continued for 10 times. 10 times in a minute. And it should be repeated and it should be repeated twice or thrice in a day, that is morning as well as at night. So this is our now Kotikotoruna. This is followed by another one. This has three. For that purpose we have to ask the person. We have to ask the person to sit in the Vajrahan. You can see exactly where it said. These two has to become in contact. You can see these two has to come in contact, and after coming contact, this is the heel, and this heel should touch into our particular portion of our ischium, which we define as ischial tuberosity. This is defined as our Kukundara. Okay, so this is another. Ask in our normal position. Now what we do? As I already said, one more I have left, two more I have left. Now ask the person to make a 45 degree along with the arm as well as our forearm. Arm along with our forearm. Then the person has to place his finger in a specific area. And it is interesting that it is varied from our person to our person. After measuring the area, now we try to give the pressure. Exactly the central portion we have to measure where his middle finger touch. Now we give the pressure like this way. Like this. So this is we define as our Angsha Marma. This is followed by, and the last one of our okay, maximum portion he can touch. Maximum portion he can touch. You can see it now. Maximum portion he can touch. You can see. As is a young individual, he can touch the maximum. It may vary according to the person concerned as well as here our low back pain person. Remove it. So now selecting the area. In Marma Chikitsa, area selection is very essential, which always vary person to person. Now give the pressure here like this way. Like this way you can give the pressure. There may be the different method, like somebody also wants to rotate it. But I, according to the dimension, wants to give the pressure here. And the last, but not the least, giving the or below our forefinger, our forefinger. This is defined as our Brihoti Marma. The last one. This is defined as our Brihoti Marma. These are the 7 Marma that we are giving going to pressure, except our Nitamba Marma, we are leave it. This is the condition. So in low back pain, we are giving a set or a series of Marma pressure starting from our shoulder up to our back. As we all know, the pain gets radiated from our spinal segment. Pain gets radiated from our spinal segment. Hence, it has done from our Angsha Marma and finally concluded into our Kukundara Marma.